Hello everyone, welcome to my channel Learn Nursing Easy with me. If you are the first time watching my video, please like, share, subscribe and click the notification button and stay tuned. So today we'll see a nursing care plan on patient with pulmonary tuberculosis. So patient will have persistent cough, hemoptysis, congestion. So here because of that patient is not able to remove the secretion. So ineffective airway clearance related to increased mucus plug impaction. Secondary to inflammation of the lung as evidenced by abnormal respiratory sounds. So the objective is to clear the mucus. Interventions are we have to monitor the vital signs, especially respiratory rate, rhythm and pattern. Follow positioning is done because it will help the diaphragm to go down and the patient will have enough space for breathing. And steam inhalation, it will liquefy the hard mucus and it will relieve secretions. Oxygen therapy to help in breathing if patient is having breathing difficulty. Suctioning to relieve the secretions. Nebulizer therapy, so it will liquefy the hard mucus and relieve secretion. We have to teach and practice chest physiotherapy like breathing and coughing exercise. This will help to mobilize and expectorate the secretion out, and tell the patient to take more of oral fluids. This will loosen the secretion. And incentive spirometry exercises, this also will help in expansion and help in breathing. Teach the client about all the respiratory hygiene like closing the mouth with a tissue while coughing and sneezing and using mask while going outdoors. So this all will prevent cross infection, and anti-tuberculosis medication should be started. And also you have to initiate dose therapy if the patient is not complying to the treatment. Next diagnosis is ineffective breathing pattern related to decreased lung capacity secondary to inflammation evidenced by increased effort of breathing. So the objective is to improve the breathing pattern. So here patient may have shortness of breath, labored breathing, dyspnea, tachypnea, etc. So we have to monitor the vital signs, respiratory rate and pulse oximetry for oxygen saturation. And Fowler's positioning should be provided, well ventilated environment and oxygen therapy with mask. And whenever we are caring for this patient, we have to follow strict respiratory isolation technique like wearing a 95 mask, HEPA filter, hand hygiene. So this all will prevent the cross infection. Nebulizer therapy, chest physiotherapy, inhaler therapy. So this all will liquefy the secretions, remove the obstruction, and thereby they help in preventing exacerbations of dyspnea. Advise the patient to take adequate bed rest so that it will conserve energy and oxygen consumption by the body. And administer anti-tuberculosis drug to treat the TB infection, and advise the patient to comply with all the drug regimen so that patient will prevent the complications of TBs. So in evaluation you will see whether the breathing pattern is improved. Next diagnosis is acute pleuritic chest pain related to inflammatory process of the airways causing bronchoconstriction and reduced airflow to the lungs. So a patient will have dyspnea, sore throat, chest pain, chest tightness, labored breathing, and some patients also have generalized body ache due to increased effort of breathing. So you have to do a comprehensive pain assessment so that we can identify the location, characteristics, severity, frequency and duration of pain, and monitor for the precipitating factors like when the activity is causing pain or during rest if there is a pain. So all those things we have to monitor, and what is the precipitating factor that we have to reduce. Fowler's position, so this will help in breathing. This is oxygen therapy, this will aid in respiration and ease breathing. And comfort devices like pillows and cardiac table to rest the patient can be given. Tell the patient to take adequate bed rest, so this will decrease oxygen needs and conserve energy. And diversional therapy in the form of music, reading books, watching TV. So this all will help in diverting the mind of the patient. And analgesics if prescribed we can give. And relaxation therapies like deep breathing and coughing exercises. This can relax and help the patient in breathing. And anti-tuberculosis drugs should be administered. So this will treat the infection and also help in easing the effort of breathing. And warm showers or bath can be given in order to treat generalized body ache, and reassurance and psychological support will provide comfort for the patient. Next is ineffective thermoregulation, hypothermia related to infiltration of neutrophils and inflammatory mediators secondary to pulmonary infection. So patient may have fever, chills, night sweats, etc. So you have to maintain normal body temperature and monitor vital signs, especially temperature. Adequate ventilation should be provided. Cold compressed tepid sponging to decrease the temperature should be given. And advise the client to stay indoors and wear a N95 mask so that it will prevent cross infection. And whenever we are giving care for the patient, we have to follow strict isolation technique. and keep in the isolation room and avoid visitors entering the room. And nebulizer therapy can be provided, so this will relieve the secretion. And chest physiotherapy, again this helps in mobilizing the secretion and expectorating it. And tell the patient to take lots of oral fluid and fruit juices, so this will decrease the temperature. Antipyretics can be administered to treat fever and administer all the anti-tuberculosis drug, and also advise the patient to comply with the drug regimen so that TB can be treated and thereby fever will also be reduced. Patient may have anorexia, weight loss, cough during food intake, decreased energy, inadequate dietary patterns. So because of that there will be imbalanced nutrition, less than body requirements related to chronic anorexia secondary to productive cough while food intake as evidenced by weight loss and fatigue. So our goal is to maintain the normal dietary pattern. So you have to assess the nutritional status, nutritional needs of the client, and monitor weight regularly. Tell the patient to take balanced diet and foods rich in iron, protein, vitamins like green leaves, vegetables, pulses, fruits and meats has to be given. This will improve the immune system and thereby it will help in fighting against infection. And teach the client to maintain nutritional diaries so that we can know what all the foods are consumed and if there is need for supplement nutrients. And avoid high fat, high cholesterol, red meat, so this will prevent further infection. And multivitamin should be administered, this will prevent vitamin deficiencies. And we have to identify the food preferences, and according to that we have to make a dietary menu plan for the patient so that patient can follow the food pattern. And tell the patient to take more of oral fluid. In case of poverty, you can orient the client to some voluntary agencies who can provide adequate nutrition. So with all this you can see the patient's nutritional pattern will be improved. Next is activity intolerance related to decreased tissue oxygenation secondary to infection of the lungs, characterized by formation of tissue granuloma and alveolar macrophages. So because of that patient is not able to perform activity, so we have to increase the client's tolerance to activity. So monitor vital signs and ability to perform activity, and if patient is doing activity you have to support them with oxygen therapy. And adequate rest has to be provided between care activities, and advice to avoid strenuous activity and assist all the activities of daily living. Teach and practice mild exercises on bed when patient breathing is normal. And all articles like call bells and assistance should be provided at the bedside of the patient. And teach and provide pulmonary rehabilitation measures so that it will help in gaining independence. And anti-tuberculosis medicines as advised patient has to take. Teach and make the client practice deep breathing and coughing and incentive spirometry exercises. So these all will help in ease the breathing pattern and also improve the tolerance to activity. So in evaluation you have to see whether the tolerance to activity is improved. And next is ineffective health maintenance related to lack of knowledge about the disease process and therapeutic regimen. So because these patients has to take a long term drug therapy, so sometimes they will not be able to maintain their health. So in nursing intervention you have to identify the client and others the ability to understand instruction. And in home management of oxygen therapy, nebulizer therapy, inhaler therapy, if it is used, then you have to teach the patient how these therapy has to be done at home. And pulmonary rehabilitation measures you have to teach so that they will aid in respiration. And tell the patient to schedule activities with respiration, so he has to take adequate rest in between activities. And nutritional management, so like protein, carbohydrates, vitamins, so this all has to be included in the diet so that it will prevent weight loss. And pharmacological management, like all the anti-tuberculosis drug, their side effect, their dose, everything should be taught. And also you have to tell them to comply with the treatment. Teach the patient need for isolation technique like wearing mask, social isolation, hand washing, respiratory hygiene like using tissues or elbows while coughing and sneezing, so this will prevent cross infection. Next, educate the client to have a regular follow-up so that it will prevent complications. And you have to provide guidelines what all should be followed at home, so this will help the patient to maintain a safe health at home. And finally, nonsense related to lack of motivation and long-term nature of treatment. So because these patient has to take treatment for a long time, they will not follow the complete treatment protocol. So our goal is to aid in compliance to TB management. And here the nurses has to go do a home visit and identify the TB patients, register them, and also we have to start the DOTS therapy. Okay, so that is a direct observation and treatment of short term course. So every day we have to observe the patient whether the patient is taking the drug, and if there is so many numbers of drug, nowadays there are combination of drugs where 4 or 5 drugs is coming in one drug, so you can advise the patient to take those drug. And if patient has to travel for a long journey to come to the area to take the drug, then we have to give incentives or transport allowance for the patient. And all the complications regarding non-compliance like multi-drug resistant TB, extensive drug resistant TB, so this all has to be taught so that patient will comply with the treatment. Whichever TB registered clients are there, we have to visit on regular basis and motivate them to take the drugs properly, and educate client and significant others at home to follow the isolation practice, and guidelines and protocols should be given so that they will follow at home. So with all this, patient may comply with the treatment. So this is about the today's class. I hope you have understood my class. Thank you for listening. Please like, share, subscribe and click the notification button and stay tuned.